Hi, hi, can you hear me? Sorry.
Yes,
Thank
we can.
you, Mr. Gove. Just a couple of questions, please. Um, Mr. Gove, you say the Prime Minister and the Health Secretary getting the virus shows it doesn't discriminate. Unfortunately, they only have mild symptoms. But you can't guarantee that they won't become more poorly at the very moment that the country and the NHS most need them to lead. Lots of people watching this will be asking why the Prime Minister, the Health Secretary, and now the Chief Medical Officer weren't better protected. Isn't this at best careless and at worst negligent? And to Simon Stevens, a couple of questions, if I may. The new London hospital will have 500 intensive care beds by next week. How much spare capacity is there in London's critical care beds today? How do you expect that to change over the weekend? And do you anticipate you'll be over capacity by next week? And just on the testing and NH staff, great news that you're going to roll out testing, but how many NHS staff are currently unable to work because they're either unwell or self-isolating? Thank you.
Oh, thank you, Beth. Uh, the the fact that the virus is no respecter of individuals, whoever they are, is one of the reasons why we do need to have strict social distancing measures so that we can reduce the rate of infection and reduce the pressure on the NHS. There have been various estimates about the number of people in any country who may become infected over time. We aim to, as the Prime Minister himself has pointed out, flatten the curve, reduce the rate of reinfection in order to ensure that the NHS can be protected. And I think that many people will reflect on the fact that the Prime Minister succumbing to the virus is a reminder of how seriously we all need to take the advice that the NHS has been giving us. Simon.
Thank you. Yes, so on the question of London hospital beds, as of yesterday, the most recent figures, we had just under 3,000 empty and available hospital beds across London. And as you say, Beth, we are bringing on additional beds next week at the new NHS Nightingale Hospital. That is being configured initially to be able to look after up to 500 patients, but there is the physical capacity to potentially take that to up to 4,000 if it were required. So there is obviously an enormous effort going on, not just across London, but across the Midlands as well, where we're seeing continued growth in cases. And that's why, as well as freeing up the 33,000 hospital beds across our current English NHS hospitals, we are also taking these unprecedented steps to build in a few days hospitals that would normally take years.
Thank you very much. And we'll turn now to Andrew Woodcock from The Independent.
Mr. Gove, there are large numbers of people around the UK who are reliant on food distribution through food banks and other charitable efforts. These charities are still working, but many food banks have closed and donations are down. Many volunteers are over 70 and they've been advised to stay home. The Independent's launching a Help the Hungry appeal to support the London Food Alliance, but there's need right across the country. The government says it's supporting all sections of society through this crisis. So is there going to be financial and logistical support for these charities? Are any of the 700,000 people who volunteered to help the NHS being committed to this effort? And Sir Simon Stevens, could I ask, you've been head of the NHS since 2013. Do you regret the bed reductions and the failure to increase nurse training numbers during your tenure, which have left the NHS in a position where it entered this crisis with its critical care bed base amongst the worst in Europe, with Italy, for example, having twice as many ICU beds, and the UK having the lowest number of nurses and doctors per head amongst developed nations, according to the OECD? Isn't the lesson from this crisis that the NHS needs more capacity at all times if it's going to be ready to deal with this kind of surging demand, and it can't be made to operate with no slack as it has been under your watch?
Andrew, thank you for those questions. On food and helping the vulnerable, let me say a few things. The first thing is I want to thank all those who work in food production and in our supermarkets for rising to the challenge of making sure that our shelves can be refilled and that people who need it are able to get the food that they need. Now, of course, we need more than simply to have an effective food production chain. We need to make sure that those most in need, those who are self-isolating, get the food and the other support that they need. That's why the NHS has identified up to 1.5 million people who are shielded, who've been advised to self-isolate for 12 weeks, and it's why government departments working together are ensuring that there will be food distributed direct to those individuals, with community pharmacies also providing the prescription medicines that they need. Now, there are people beyond that 1.5 million who are not self-isolating for 12 weeks, but who are vulnerable, people who in the past have used food banks, people whom we need to support now. And it is the case that the volunteer networks that have been set up across the country are ensuring that we can match volunteers who are willing to go shopping and to hand food to those vulnerable people who are staying at home or who may not themselves have the social networks to get the food that they need. And of course, the tremendous response to the Good Sam initiative that Matt Hancock announced earlier this week, with hundreds of thousands of people stepping up, is an amazing example of voluntarism in action and national solidarity. And we will be doing everything we can to support them. And my colleague Oliver Dowden at the Department of Culture, Media and Sport is looking at a specific fund in order to support charities in the work that they do. And we'll be saying more about this in the days to come. I also want to thank those people in the hospitality and catering sector who have stepped up and who are doing everything they can to support the vulnerable. John Vincent of Lyon is making sure that his stores remain open as takeaways in order to support the NHS. It's that sort of collaboration between citizens, the voluntary sector, backing from government, and enlightened business people that I think will help us to beat this virus. And I'm grateful to you for the opportunity to thank all those who are making that contribution. I'll now hand over to Simon.
Thank you. So the NHS does need more staff and it does need more hospital beds, and we've been saying that for some time, and that is what's going to be happening over the next 5 and the next 10 years. But the reality is that what I've described is that over the last several weeks, we have freed up the equivalent of 50 hospitals across England ready and waiting for coronavirus patients. Under normal circumstances, you would not keep 50 hospitals fully staffed with nurses and doctors not actually looking after patients, which is why no health service in the world, anywhere in Europe, anywhere internationally, would be able to withstand a coronavirus epidemic unless the sort of measures that the public are also involved with are also put into place. And that's why it's so important that the public support the work of our very pressurised frontline nurses, doctors, therapists and other staff across the NHS by staying at home and in so doing saving lives.
Thank you. And we'll turn now to Tim Ross from Bloomberg.
Thank you. Michael Gove, we were told before the